If you see adult collapse on the ground, try to relax and do hands-only CPR to help them. First, need to call emergency response number. Then, get directly to the victim. Put the heels, one of hand in the center of the chest and other hand on top of first. Then push hard and fast in the center of the chest until help arrive. You need to push hard and fast for 100 to 120 compression per minute. Remember, call your local emergency number, then push hard and fast in the center of the chest until help arrives. After done doing 100 to 120 compression, check for their responsiveness and breathing, and if they respond, wait for the emergency to arrive, and if the victim didn't respond, continue to do the compressions. Arm splinting. If you see someone who's having injury at hand, you need to place the victim in a sitting position, and then you need to check the arms of the victim if there are any swelling, pain or blood at the hand, and then you need to take something that can stabilize the hand with an assistant. Put the board under the arms, and then you need to tie at the elbow area using the triangular bandage or normal bandage. During doing, you need to always be careful. Just need to make sure that no injury can occur more. And then you can tie at the wrist too. The tie not too loose or not too tight because it will affect the blood from flow. After done, stabilize the victim hand. You can bring or wait for the emergency department to come and send to the hospital for the further checkup. Next, for the leg splinting. First thing first, you need to ask for their responsiveness. Check their injured area if there's any swelling, pain or blood or anything. Put the splint around the injured area carefully. Wrap the splint around the injured area slowly to make sure the leg is fully supported. Repeat the same things and wrap the leg more to secure the leg. After done doing splinting on the victim, you can wait for the emergency department to arrive for the further checkups. For the arm sling, ask the victim to support their arms with their other hand. Gently slide the triangular bandage underneath the arm. The point of the triangle should be underneath the elbow of the injured arm. Bring the top end of the bandage around the back of the neck. Next, fold the lower end of the bandage up over the forearm to meet the top of bandage at the shoulder of the injured side. Tie the two ends of the bandage together in a reef knot above their collarbone and tuck in the free ends. Adjust the sling so that it supports their arms all the way to the end of the little finger. Make sure that the edge of the bandage by the elbow is secured by twisting the fabric and tucking it in, or using a safety pin to fasten it. You need to check their circulation in their fingertip every 10 minutes. Press their nail for 5 seconds until it turns pale, then release to see if the color returns within 2 seconds. Then can send to the hospitals to further check up. Ask the victim to support their injured arm across their chest with their finger resting on the opposite shoulders. Lay the triangular bandage over their chest on top of the injured arm with one end over their uninjured shoulder. Hold the point of the bandage just below the elbow on the injured side. Next, tuck the lower part of the bandage underneath the injured arm. Bring it diagonally across their back to meet the other end of the bandage at their shoulder. Tie the two ends of the bandage together in a reef knot above their collarbone and tuck in the free ends. You need to make sure that the edge of the bandage by the elbow is secured by twisting the fabric and tuck it in, or using a safety pin to fasten. Check the circulation in their thumbs every 10 minutes. If it's too tight, then loosen it and readjust it. After that, you can send it to hospital for the checkup. For the scalp injury, you need to stop the bleeding by put some pressure on the injured part. And fold the triangular bandage, the base of the bandage at least 1.5 inch. Place the folded base on the tip of the eyebrow and making sure that the folded base is placed outside. After placing the folded base on the bandage on the tip of the eyebrow, ensure that the apex is directly on the opposite side. Basically, the apex will be at the back of the head. Once the points are on the back, simply make an overhand, ensuring that the overhand will cover the apex. Remember, the bandaging rule is not too tight and not too loose, so to ensure that your overhand is good enough. After making the overhand, bring the points at the front and bring it just on top to fold it. And make sure doing a square knot. From there, just insert the apex at the back on the overhand and insert the square knot on the folded base. After that, you can wait for the emergency to arrive, or you can send it to hospital for the further checkups. For the forehead injury, the first thing first that you need to do is stopping any bleeding and cleaning the wound, and fold a large bandana sized cloth into a triangle. Place the bandage on the injured person's head with the tip at the back. bring the two ends across the head just above the ears and cross them back. Bring the two ends back to the center of the forehead, tie end together, and tuck them off bandage snugly under the wrap. You need to make sure that the tie is not too loose and is not too tight, just to make sure that the injured person is okay. And then after you're done doing that, you can send to the you need to wait for the emergency to arrive, or you can send it to hospital. For the ankle sprain, you need to gently palpate around the outside of the ankle in the area of the pain. Next, if you see a swelling or redness on the leg, you need to start doing the wrapping an ankle. First thing first, you need to wrap the tape twice around the ball of the foot below the toes. Wrap the bandage a few times around the foot and ankle in a figure 8 pattern. You need to keep the bandage tight, but make sure the circulation is not cut off. Finish by wrapping the bandage twice just above the ankle and use a fastener to adhere the bandage. You need to make sure that the ankle is unable to move, but the bandage is not uncomfortably tight. If you see swelling, stiffness around the elbow, you need to do an elbow figure of 8. First thing first, you need to place the tail end of the bandage on the inside of the joint and start passing the bandage over around the injured area. Make 1.5 turns so that the tail end of the bandage is fixed and the joint is covered. Pass the bandage to the inner sides of the limb just above the joint and make a turn around the limb so the upper half of the bandage is covered. Pass the bandage from the inner sides of the upper part of the limb to just the below the joint. Then make one diagonal turn below the joint to cover the lower half of the bandage. Continue to bandage diagonally above the below the injury in a figure of 8 pattern. Extend the area of the bandage each time you wrap the bandage around the joint. To finish the bandage, make 2 straight turns around the limb and secure the end of the bandage with a safety pin or adhesive tape. Check the circulation beyond the bandage as soon as you finish and recheck every 10 minutes. To do this, press the skin beyond the edge of the bandage and check the color returns to the skin within 2 seconds. You need to examine hand by doing a palpation in hand. Ensure that you wrap the bandage at the victim's hands above and below the joint. Begin the wrap at the lower part of the forearms, and then you need to overlap each layer of the bandage about 50%. And you need to make sure that the figure of 8 patterns is appeared during the wrap, because it will create the joint stability. And you need to make sure that the wrapping is not too tight and not too loose. Once you have covered the whole hand with the bandage, secure it with a safety pin or clips. After that, you can send it to hospital for further checkup.